Hello, and thank you for watching ganjarunner TV. I'm Jay Gloria, and today I have with me Dr. Kent Crowley. He is the founder of Trokie and the inventor of the Trokie Cannabis-Infused Lozenge. So how are you today, Dr. Kent?
Fabulous. Thanks for inviting me.
I wanted to get a little bit of the backstory from you. When did you decide to pursue cannabis and medicine? Tell us about your background as a pharmacist. What led you to develop Trokie?
Well, I've been a compounding pharmacist for quite a long time. And what got me into the cannabis arena was the request of problem solving some drug delivery issues with a couple cancer kids up in the Bay Area. A PA that I worked with in Nevada had a boyfriend, which was a retired Navy SEAL. His brother was a sous chef up at the top of the mark and was making cannabis edibles, and just ran into some kids he wanted to help and asked his brother, which asked his girlfriend, which asked me, Kent, can you go help him? So with the confidence of being protected by that ex-Navy SEAL, still thinking that cannabis was actually a gateway drug. I hadn't done any research on it at all, hadn't used it since, high school, and went ahead and gave it a look at. And what I found was amazing. I learned that we had been misled. There was a ton of data on its medical efficacy and value. And so I looked at the material they were working with, which was an extract, and I looked at the condition of the children, and it was just blatantly clear. Let's use buccal absorption. Let's not make them swallow anything. Let's avoid, a poor functioning gut. Anyone that's on chemotherapy has a poor functioning gut, and let's try and optimize this very complex, hundreds of active chemical, actives in it. Let's see if we can deliver it in a way that's going to be reliable. And so the Trokie delivery system was immediately something that came to mind for me, and it worked rapidly. And Sean Smith, which was my first partner in this Trokie business, was good friends with Ryan Hudson at the Apothecarium. And so we took this creation over there and talked about it with him. And he said, Kent, you got to do something serious with this. We've never seen anything like this in the cannabis space before, and it works amazingly well. So that's kind of how Trokie evolved. And then we developed a patent around the process. And based on the feedback that I was getting from prominent people in the Bay Area that have been playing with cannabis, both in the business side and medical side for the last 40 years, I said, this makes perfect sense. Let's try and make a business out of this. And I really wanted to have a positive impact on health and change the way that cannabis was viewed. Remember that when you work in functional medicine, I'm board certified, fellowship trained. I've worked in an area that has constantly been challenged by standard of practice. They don't look at lifestyle changes, vitamins, minerals, herbs as solutions or as a treatment option generally in our Western medicine model. And so I'm used to hearing stories of inappropriate treatment because of lack of double-blind placebo-controlled studies, making the treatment valuable and scientifically sound. Well, you can't do that in a lot of natural medicine. There's too many actives, too many control. There's too many things that you can't control. And so you have to look at it broadly and not at a mechanistic clamp upstream or downstream, and what does that do? And that's one of the problems that we're challenged with in doing anything with natural medicine, where you have, cannabis and whole plant extract has over 500 physiologically active substances in it. And it's very difficult in order to control all of those variables and create in our current scientific model an argument that this is, a cause and effect outcome.
Right, I see. So what can you tell us about the research you've done and some of the testing you've done, and what type of feedback have you gotten from the medical community? Do they take it seriously? Is it written off?
It's really changing. More and more practitioners, especially the ones in the alternative world, have recognized you can't ignore anecdotal evidence. When you have 50 people come in and tell you the same story of how it's helped them, it's hard to ignore stuff like that. In our palliative care corp clinic in Huntington Beach, we've seen well over 2,000 patients. 60% are cannabis naive, and they're looking for a therapeutic solution to what isn't working currently with their doctors, or they're looking for help while they go through cancer therapy. So there is a large number of patients out there that aren't well controlled. For instance, chronic non-cancer pain with opiates. It's not working well for them. They have a lot of side effects. They have a lot of frustration with both their physician and with just the pharmacy, even getting their prescription filled that's valid. And so they're looking for, how can I get off opiates and how can I improve my pain control? And what we found, and I published on that recently in Frontiers in the neuropharmacology section, was that data that we collected on chronic non-cancer patients on or not on opiates, and the impact of adding cannabis to a pain therapy regimen. And, we had about an 85% reduction in opiate use in the first group of 20. Out of the 49 patients, we had 27 that were on opiates. And we saw better, and this is in 100% of those subjects, better pain control, better quality of life with cannabis. It has no toxic overdose risk. It doesn't stop your ability to breathe when you add other CNS depressant type products like an opiate or a benzodiazepine. And so it can be safely added to any pain therapy regimen. And then once we identify what that best mix is, what that patient's response is, then we can start tapering off and lowering some of those other meds that aren't disease state modifying. And it's very important to understand cannabis is a disease state modifying adaptogenic herb. Our body looks at adaptogens and can recognize and utilize actives within that herb at different times in different amounts. An adaptogenic herb is always focused at trying to allow the body to reach homeostasis, that balance that we're always looking for.
Right.
Cannabis is an adaptogenic herb that helps us reach homeostasis. All of these other medicines that we're using are not designed or able to accomplish that goal. Now, I'm not saying that we throw them all away. They're very neat. They're, Western medicine has done fabulous things for acute treatment and survival. We don't toss it out with the bathwater, We recognize the value and when certain things need to be applied. And the cool thing with cannabis is there's very few situations where Western drug therapy is being used where there is a risk of a drug interaction.
Wow. Pretty amazing stuff. And I totally agree with you. We hear those stories every day here at ganjarunner from patients who are, sometimes when they're starting out, they're not really totally sure what they're going to get out of it, but they start to work it in, and they start to get relief from a variety of symptoms. And like you said, they just start cutting out some of those other prescription drugs that may have more harmful side effects. So it's great that we have doctors like you coming out and really pushing the envelope here.
Well, everyone needs to realize that not one treatment, not one product works for everyone. And there are a lot of people that don't respond to certain ratios or formulas of cannabis. Some don't respond to oral, some don't respond to buccal, some don't respond to THC. They have a very dysphoric effect, as well as people taking CBD. It can cause a dysphoric or a blunted effect in certain people. So we got to recognize that there's a whole lot of things that need to be assessed when we go in to use cannabis. And one of the cool things that you guys do is you guide people based on your experience. So you're not going to set someone up for a bad experience, because you're not going to give a novice something that's going to expose them to a bad side effect. So, it's wonderful to work with knowledgeable operators in this space, and in utilizing things that are standardized, so that you know what's in the product, you know the dose, you know how much neutral THC, how much acidic THC, how much CBD. You've got a good set of guidelines that you don't put a dose out there to a patient and risk an adverse event.
Right. Well, I appreciate that, and we're honored to have Trokie, and just giving people as much information as they can so they can sort of start small and work their way up. That's the best formula. So what other types of ailments do your lozenges, what other types of ailments are they able to help? And what can you tell us about the different types of ratios between CBD and THC? What's sort of the goal there?
Well, in our clinic, we learned kind of the hard way that for someone that hasn't consumed cannabis in the past, we always start them on a CBD trokie. That is a go-to, just something that will tell us how that patient responds to one of the cannabinoids that is not psychoactive. And many of those patients are on other medications. And so we can see how their particular condition is responding, and then add or adjust, generally moving to a 9-to-1 or a 1-to-1 to a 15-to-1. And we're always talking CBD to THC. So those are ratios, all the way to a very high, we don't even look at the content of CBD in some of the high THC products. So what are the conditions? The conditions are anything that we recognize is a disease state. So, the top ones that we see in our clinic are pain, cancer, autoimmune. Autoimmune hits a huge number of disease states, and they all are tied in with chronic inflammation. So cannabis lowers inflammation. Route of administration can improve the amount of inflammation lowering that you get. So smoking, it's a quick onset. It's a fairly short duration, so you have, 5 minutes or less for an onset and a duration of 1 to 2 hours, depending on the amount that you smoke. That has the least impact on looking at inflammatory markers in our blood, like cytokines. Any other route of administration outside of topical will improve that lowering of cytokines better than that route. But that route of administration, inhalation, really important. Trokie fits into a unique spot where we have as short as a 5-minute onset of action, but a duration similar to an edible. An edible should be considered something like a food product, where you are swallowing it and it requires digestion and passing through, your liver for metabolism. So if we're talking about a trochee going into the oral mucosa, holding it between your upper cheek and gum, that will take maybe 30 minutes to dissolve. But if we look at a migraine patient, we have migraine patients come in in a migraine. Traditional meds may or may not be working, but they're looking for a better solution. And what we've found in over 80% of patients with a migraine, doesn't matter what the cause, whether it's environmental or hormonal, 80% or greater will have a 50% reduction or greater in their pain scale. 0, no pain, 10, unbearable pass-out pain. They'll have a greater than 50% reduction in that pain in under 15 minutes.
Wow, that's amazing.
Very few medications out there that can tout that average.
Right.
So migraines, all kinds of different types of pain, whether it's cancer-caused or non-cancer. We've had taking oral capsules of high THCA, which is the acidic form of THC, in ulcerative colitis. We've seen a histologic cure. We've seen a number of remissions in stage 4 metastatic cancer that the doctors have given up on the patient. I can't do anything more for you.
Wow.
And gone to cannabis, and we have, with our protocols, we have remissions. I believe we have over 40 remissions in stage 4 metastatic cancer.
Wow. So does the trochee specifically act on that as well?
It's used, we've had resolution of prostate cancer, non-metastatic, with as little as 25 milligrams of the CBD trochee twice a day for 3 months.
Wow.
So it's all over the board. We We do hardcore presses, using a Rick Simpson type protocol where we're pushing 600 and 900 milligrams of cannabinoids per day for at least 60 days. And we've had great results and we've had failures. And we still don't understand why.
Moving forward, what are your hopes for the future of the cannabis and medicinal marriage?
Well, we have to get it off of Schedule 1. So our federal government is still, I believe now, criminally ignoring the scientific evidence that should take cannabis in all forms off of Schedule 1 status, which means with the Controlled Substance Act, something that does not have any medical recognized value and is highly addictive. We know that we are taking people off of, getting them off of alcohol, off of opiates, very successfully with the use of cannabis.
So who's is standing in our way, in a sense? Who's the holdout? Who's against this this type of progress?
I don't know who the one individual is. I don't know that there's any one. I know that Big Pharma is terrified just by looking at what we see in reductions in regular disease state meds, high blood pressure meds. I mean, I get 50% off, 50% of patients off of their high blood pressure med by using cannabis. This is scary stuff. We see improvement in blood sugar. We see removal of the antidepressants and antipsychotics in many people. Gone. They don't need them. They don't need their benzos. Their anxiety is being controlled with cannabis in the appropriate form. Generally, it's way far on the CBD side of the spectrum, but they're able to actually function and not need to take their Ativan, Xanax, Valium, you name it. Sleep, insomnia, profound outcomes there. Yes. Again, not interrupting REM sleep. This is all good stuff.
Now, does that come from the CBD or from the THC or both?
It depends. It depends on the person. It depends on the dose. Low dose THC can be stimulatory in a lot of people. If you are on the autism spectrum and you take CBD, that's stimulatory for some, and it's relaxing for others. So the problem is there isn't any, we can guess about 70-80% of the time, but we're still surprised.
Yeah, like I have some friends when they take a sativa get really hyped up and energized, but for me it still makes me sort of more in the mellow, drowsy.
Well, I've done some of my own studies, and I've told people this is a sativa and this is an indica, and I've gotten the response when it's absolutely opposite. Right. So the power of suggestion, the placebo effect, all play into this, world of cannabis. But I'm trying to get away from the sativa and the indica labels and really look at the terpene profiles and recognize that they truly are more important than that previous label. Everything's a hybrid.
How does one get started with dosing with the Trokie?
We generally would start a patient on there's two forms now. You're seeing the bars on the California market, which are all 50 milligram bars with 5 servings, so 10 milligrams of whatever the actives are. So if it's a CBD, it's 10 milligrams of CBD. If it's a 9-to-1, it would be 9 milligrams of CBD and 1 milligram of THC in the neutral form per serving. And if it was one of our indica bars, that would be 10 milligrams of THC in the neutral form. So we generally start people on, well, for any cannabis product, 2.5 to 5 milligrams of THC is tolerable for cannabis naive patients that you're not consuming cannabis for, or haven't consumed cannabis in the past. We will start people on CBD troches to find out what their response is and to avoid and preload them for exposure to THC in the 3-4 days later, because CBD can help be an antidote to the psychoactive effect of THC in the neutral form. So start them on CBD, see how they respond. If we're not hitting the endpoint of pain control, anxiety control, whatever we're looking for as a symptom treatment, then we will add what we think is probably the next thing to go for. So some will go to a 1-to-1, some will still stay on a on a higher CBD dose, but we'll add 2.5 to 5 to 10 milligrams at night. They sleep through it mainly. If they get stimulated, well, then we'll deal with their unique response to the THC side. Some that have had experience taking, party animals back in high school and college, and they never had a dysphoric effect. They didn't get paranoid from taking THC. We'll be much more aggressive with them.
Right. Now, what about the person who is sort of looking for an everyday supplement, something to boost their vitality as sort of a preventative measure? Would the Trokie be good for that?
I think our 9-to-1 as a daily vitamin, 9 milligrams of CBD, 1 of THC, as long as they don't have a risk for, testing positive for THC and risking their profession or their job. That is something I think everyone should be on. I think every kid in sports should be on a pure CBD product. Any adult that's doing sports. I mean, the effect that we get in professional athletes using CBD is profound. Not only are they're able to perform better, but their recovery is much quicker.
Now, do you think they'll end up banning that in some of the major?
No, it was approved by the. I'm not sure what. I don't remember the World Athletic Agency's name is, but I think this year CBD was approved for use in professional and collegiate sports.
Wow. Okay. So does that mean they've deemed it not performance enhancing?
Not like growth hormone or testosterone.
Right.
Or EPO.
All right. Cool. Well, Dr. Trokie, thank you so much. I'm sorry, Dr. Crowley. Can I call you Dr. Trokie?
Well, that's my handle on Instagram.
Oh,
DRTROKIE.
Yeah, I don't know. I always just think Dr. Trokie. Well, thank you for joining us. Thanks for telling us all about your lozenges and Trokie. I think this is really exciting stuff, and I hope that all the work that you're doing comes to the light, and that we can get more people trying cannabis to treat pain and other serious conditions.
Well, keep doing the good job you guys are doing out there.
Thank you very much. All right, you have a good evening.
All right, you too.
Take care.
All right, you too.
Take care.